We spoke about anal fissures earlier on, and I said that anal fissures is basically, can you see this tear? All right, this tear in the anal region. All right, a tear in the anal region. Okay, so we said that there are various ways you can be able to what manage this tear in the anal region. One of the ways was you should start taking food that has a lot of roughage so that your stool is very soft. Okay, then another way was surgical approach. Okay, and on this surgical approach I said there's something known as what fissurectomy. Fissurectomy. Okay, so fissurectomy is a surgery that can be done for anal fissures, right? And basically you're trying to what um remove or excise the anal fissure. All right, so now let's look at fissurectomy under the various headings. Okay, we said that fissurectomy is a surgical procedure that involves removing or excising an anal fissure. What is an anal fissure? An anal fissure is a tear in the lining of the anus. Okay, what are the indications when you should do a fissurectomy medical procedure or surgical procedure? Okay, as when you have chronic anal fissures, that's the patient, anything chronic has been there for a very long time. So the patient has been having these anal fissures for a very long time, all right? So you might opt in for the surgical remedy. If the fissures are resistant to medical therapy, you opt in for surgical remedy. If there's severe anal pain, you might just opt in for the final remedy, which is what? Surgical intervention. If there's rectal bleeding, if there's fecal incontinence, right? You might want to opt in for the surgical um, treatment. Okay, so what are the types of fissurectomy? There's an open fissurectomy, there's a closed fissurectomy, there's a laser fissurectomy. Okay, so you can see this one is a laser one. Open one is like just the open surgery, while the closed one you can be using a scope to do the surgery. All right, procedure. First of all, how is this done? You prepare the patient, so bowel preparation, anesthesia, and patient positioning. All right. So patient positioning can be lithotomy or could be prone position, right? Then surgical technique is you incise into the anal canal, you excise the fissure, then you close the wound. All right. Then post-operative care, you managing for what? Pain, and you tell the patient to be taking stool softeners, which can be medications that will help the stool to be soft, or you can just tell them to basically what be eating roughages so that to basically make their stools soft. Okay, this is fissurectomy, right? This is an anal fissure, and they're excising the fissure out. Okay, to allow the body to heal back. Okay, so what are the benefits? It will relieve the anal pain, it will promote healing, it will reduce what? Bleeding, it will improve the quality of life. Right? What are the risks and complications? It will lead to infection, it will lead to bleeding, lead to fecal incontinence, lead to anal stricture, lead to what? Reoccurrence of the fissure. Alright? So that's it for the fissurectomy surgical procedure under the various headings that we looked at. It. Indication types, procedure, benefit, risks.